We are going to go ahead and get started with your posture assessment today.
Okay.
So I have quite a few things that we'll be going over. It's going to be a lot of me making adjustments.
Okay.
Some of it may seem very repetitive. I'm going to be moving you around and kind of manipulating you in a way that allows me to assess your posture as well as correct a few things.
Okay.
So if it's all right with you, I'd like you to just relax. I might ask you to sit up straight at some points. I might ask you to slouch. I'll be manipulating your limbs, your shoulders. Just allow me to kind of move you around as I will.
Okay.
And that'll help me get a better feel for what we need to work on today, okay?
All right.
Okay. So I did just want to go over just a couple of things so I know exactly what we're looking at today.
Okay.
So you did say you were having some headaches.
Yes, I am.
As well as some trouble sleeping.
That's correct.
And
yes.
you believe that's possibly related to your posture as well as your job.
I do, yes.
Okay. So you work from home, correct?
Mm-hmm.
Spend a lot of time in like an office chair?
Yes, too much time.
Okay. So this is a common complaint that I see with a lot of my clients. It's kind of nuanced, but to put it briefly, your posture plays a lot into your body's ability to rest. So if your posture is poor throughout the day and you're not maintaining a proper upright position, it can kind of trickle down and affect your sleep.
Okay.
So it's something that we'll be looking at today, and I'll be trying to help you make some kind of micro adjustments so that you can make a long-term change that will last versus something like a more physical, like a chiropractor does, like the cracking adjustments. So that's not something we're going to be doing today.
Okay.
I'm going to be making very minor adjustments, some that you might not even notice, but my hope is that with a few weeks of treatment you will see a difference over time. Okay?
Okay, sounds good.
Okay, perfect. So is there any particular area that you're experiencing pain in today? Any areas that you're concerned might be a little bit uncomfortable with manipulation?
I'm concerned with behind my shoulders and my lower back.
Okay, so those are the two areas that you would say are most affected.
Yes.
Okay, all right. Well, I've got a variety of things that we're going to go over, so if it's all right with you, I'm going to just go ahead and get started, okay?
Sure, ready.
Okay. So I'm going to start with an overall visual assessment. Essentially what that means is I'd like you to just kind of sit as you naturally would, so don't try to elongate yourself in any way, just sit relaxed, and I'm just going to kind of assess what we're working with, okay?
Okay.
Perfect. So just having a look overall. So your natural posture is fairly symmetrical, meaning I'm not noticing any wasting particular to one side. I would say you maybe have a very slight lean here on the left. How tall are you, James?
6'1.5".
6'1.5". Okay. So a fairly tall individual. And I do find that with my taller patients, posture tends to be an issue, especially where the limbs are maybe not particular in ratio with the body, which tends to happen with taller individuals. It can create kind of like a lanky movement, if you know what I mean. So to give you an example, if we look at someone like Kevin Durant, very tall, very long limbs, tends to look a little bit lanky, kind of arms hanging, and that's natural just because the arms are longer in proportion to the body. So his wingspan is actually taller than his height. Doesn't look like your arms are quite as long, but I will be taking a couple measurements, and that's just something to keep in mind, okay? So I see a little bit of a rolling forward of the shoulders. So that's definitely something that we will address. Okay. Can I have you turn your head for me all the way to the right? Okay, so I am noticing just a very slight misalignment in the shoulder area here. This here, kind of where you're feeling some of that pain.
Yes, it is.
Okay, so if I can just have you turn to the left for me. Okay, so not quite as bad on this side. Are you left or right-handed?
Right-handed.
Right-handed, okay. Do you find that you use your left hand in any day-to-day activities, or are you predominantly right-handed in everything you do?
Predominantly right-handed.
Okay, so you definitely favor the right side. So if I can have you stretch your arms out for me, so just extend forward. Perfect. Okay. I'm just going to straighten your elbows here. Does that feel like a hyperextension to you?
No, it doesn't.
Okay. So I'm going to have you relax this arm here. Keep this arm elevated for me. you can relax. So might need to work on just a little bit of mobility there, but it doesn't look too bad. Okay. Alright. So if I can have you tilt your head all the way back very slowly. Set as far back as you can go. Okay. And now all the way forward. Okay. Alright, you can go ahead and relax. So I'm going to go ahead and get a pair of gloves on so we can kind of move into the more physical aspect of the examination. So I am noticing that there's just a slight lack of flexibility. You should theoretically be able to move your head back and forward without moving your body. So when I asked you to move your head, you kind of moved your whole upper body.
Right.
Ideally, I'd like you to be able to mobilize your neck without moving your shoulders.
Right.
So that might be something that we can work on. We can incorporate some exercises that will help with the mobility in your neck, okay?
Sure.
Okay, so now that I have my gloves on, I'm going to go ahead and get started with a few base measurements so I can kind of get an idea of where we're starting, okay?
Sure.
So these will be kept on file. Every time you come in, I'll take a new set of measurements. And after a few weeks or so, we should start to see a little bit of a difference. So it's very gradual. A couple centimeters every session is what I would consider normal.
Right.
So starting with just a regular ruler here. So this is my yardstick. I'm going to use this to just measure kind of the broadness of your shoulders.
Okay.
So I want you to just keep your relaxed position here for me if you don't mind. So I'm just going to line the middle of my ruler with kind of midline to your nose. And I'm noticing just a little bit of a difference there. Slightly off, so your left shoulder is just slightly lower than the right. Okay, so if I can have you hold that hand out for me. About 3 inches to the wrist. Okay, so let's do the same with the left. Okay, so yeah, there's about an inch difference here, so you only have about 2 inches to the wrist here versus about 3 inches on the other side. Okay, that's fine. Okay, I'm just going to just a little bit of misalignment there. Definitely see a difference though. you extend your hand for me, please? Okay, and the other side. Okay, so we're about even there. That's good. Okay, so I'm going to begin with a couple posture corrections and see where that puts us off. Okay, so I can have you bring this leg in just a smidge. Perfect. Okay. And this side here, just relax for me. I'm going to take your hand. Just getting an idea of where your muscles are pulling from. Bit there. Okay, so I'm going to have you bring the arm up here. Okay, so definitely right here. Okay. And already feeling a lot less on this side. Yeah. So you feel how that tension is a lot different here?
Yes.
Yeah. Okay. So what do you think? Close this hand for me. Much better. Okay. Here too. Okay. So what I think is part of the problem. Now, everybody has a predominant side that they favor. So there are some people that are ambidextrous, but for the most part, the average individual has a side that they favor.
Right.
Now, some people alternate between only writing on that side or only eating with that side, and they do use their other hand for driving, for picking things up, for things like that. So something that you're not doing all the time, but day-to-day activities.
Okay.
So it sounds like you favor your right side for most activities. Not to say that you aren't using your left hand, of course you are, but I would like to see you practice a little bit more to gain some of that flexibility back in your left arm. Okay, so what I'm feeling is a little bit of rigidity on this side, likely due to just not that much use of the muscle on this side. So say you're maybe not start with driving, just because obviously it's imperative that you do that safely, but be conscious about day-to-day activities. Reach with your left.
Okay.
So pick things up with your left. Maybe try eating with your left. Might be a little bit more difficult at first, but with practice you can build up that strength there. Okay?
Yeah.
Okay. All right, so starting with just a couple things here. So if I can have you just look relax there for me. Just testing a couple things, so just relax. Good. Okay. Very good. I'm going to have you just relax palms down for me. I'm going to have you just hold your hand here. Okay. Okay. Slightly more malleable here. Okay. Alright, so just relax for me. I'm going to take your hand here and just allow me to move it around, okay?
Okay.
So you're going to feel a light pulsation. So I'll give you an example. Shouldn't hurt, but you should feel like a slight tingling. Okay? Better. Okay. Better there. Good. Okay. So now you bring your hand up and hold there for me. Hold. Good. Okay. So definitely some scapular tension there. Okay. Now, it's just so much less rigid on this side. Okay. All right, James, I am going to come around the back, have a look at your back for a second, okay?
Okay.
All right, James, so I'm just going to have a look again like I did before. So assessing your overall posture.
Okay.
Just sit pretty relaxed for me for a second, okay?
Sure.
So standing directly behind you. I do see some curving here. So just allow me to kind of manipulate here. I want you to sit up straight. So what I want you to picture is that the base of your spine is connected to your belly button, and your belly button is connected to a string that I am pulling towards the wall.
Okay.
So your base of your spine is connected to your belly button, and I'm pulling your belly button towards the wall. Perfect. Perfect. Good. So did here. Slight adjustment there. Bring your elbow here. Good. Good. want you to very slowly turn your head to the right. Stop right there. Much better. Okay, very good. Much better. Okay. So, with my hand here, I want you to picture yourself squeezing my hand with your shoulder blades and attempt to do so. So my hand is here. Try to squeeze my hand with your shoulder blades. Perfect. Relax very slowly. Okay, stay just like that. Keeping your head here, squeeze my hand. And keeping your shoulders there. Bring your elbows forward. Beautiful. Okay. So this position that you're in now is what I would say is your ideal posture. Probably feels very unnatural to the way that you normally sit. Stay like this for just a second. I'm going to grab a couple tools and come back. I really want you to focus on those core muscles and how your lower back feels in this position, okay? All right, James. Now, you should feel slightly fatigued because you are putting heavy muscle strain on muscles that you don't typically engage. So can you tell the difference in your diaphragm compared to how you normally sit?
I think so, yes.
Okay. Okay. So I want you to sit up as straight as you can. Do you hear that? Okay. So that was a natural adjustment, and that's what I'm talking about. So as we do these kind of micro movements, your body is naturally adjusting itself in a way that best suits your posture, okay? So just manipulating you in a way that I know is favorable. So still needing quite a bit of resistance on that side. Okay. Any discomfort here on that left side? Feel that difference in tension here?
Yes.
Let's turn as far as you can without overextending. I want to practice a couple mobility movements here, okay?
Okay.
So let's realign. So again, pulling your belly button. You're squeezing my hand. Good. Perfect. Now, so I want you to turn your head very slowly to the right. Do not move the top half of your body. So simply turn your head. Very good. Okay. And now I want you to overextend that by about 1/8 of an inch. Perfect. Good. Okay, and now we're going to return. And repeat all the way to the left. Overextend just slightly. Hold for just a second. Much better. Okay. All right, let's return. And we want you to come all the way back with your head. Good. Why don't you do a big swallow for me? A little bit of tightness here in the trachea. Much better. Okay. All right, let's go forward, forward. As far as you can go, slowly. Okay, very good. Okay. So there are a few things that I'm going to want you to practice at home. And ideally you do these exercises 2 to 3 times a day, about sets of 5 each. Now you're going to want to perform it lying down, sitting up just as you are, and then standing as well. So we're performing an orthostatic test of your flexibility. And it's going to help kind of reduce the tension in those muscles and alleviate any of that rigidity that you're having here on that left side, okay?
Okay.
So what you're going to do is while you're lying down, you're going to lie flat on your back. You're not going to be able to do the head back motion, but you can do head forward and then rotate side to side.
Okay.
So you're lying on your back, you're going to head forward. Do not move your shoulders. So picture your shoulders almost strapped to something in a way that even if you wanted to, you couldn't move them, okay? So we're bringing head down, so go ahead and do it with me. So head down, 5 seconds, back to midline, head to the right, hold for 5, and then overextend, hold for 5, back to the middle, to the left, hold for 5, overextend, hold for 5, back to the middle. So sets of 3 to 5, and then you'll repeat it sitting just as you are, and then you'll repeat it standing.
Okay.
The only difference when you're sitting and you're standing is I want you to add in head back.
Okay.
Okay?
Sure.
All right. So let's keep going. So just relax for me. Already seeing a little bit of a difference here. Very good. All right, so give me your hand. Better. Okay. So more fluidity than there was before. Slightly less rigid. I'm still feeling a little bit of tension there. Okay. Can you hold your hands out for me? Okay, much more even now. Very good. Okay. Okay, so just relax for me. Okay, that's good. Hang your jaw for me. Good. Okay. Good. Okay. Much better. Okay. Okay, you're doing well, James. Just acclimating those neurons, making sure that we are taking care of everything. I am going to place a little bit of this salve on a couple points of high tension here. And it's going to feel like a menthol sensation. I'd like you to leave this on for the next 24 hours if possible, okay?
Okay.
I'm going to do just a little bit here. Good. Okay. All right, James. We are just about done with your session today. Now, aside from the exercises that I've given you, I'd like you to remember your natural stance, okay? So I'm going to help you realign one last time. So again, we're going to pull that string and squeeze my hand. And when you're aligning your head, I want you to look at a wall and pretend that your nose is attached directly in front of you, and that'll help you keep proper stance here, okay?
Okay.
Good. Okay. All right, now I'd like you to put these into practice. I will see you again in about 3 weeks if you're available. So we'll go ahead and get you rescheduled, and then I want you to come in. We're going to redo the assessment, make sure that we're making the proper progress, okay?
Okay.
Okay. All right, James. Now, as I said, that salve is going to feel a little bit minty, kind of like menthol. Shouldn't cause any irritation, okay?
Okay.
Okay. All right. Well, thank you very much. Hope you feel better soon.